Isn't it time to get your life back?
I look forward to each day now because I know I can do whatever I want to do. Where before I was reaching a point where I thought, I don't think I can do this any longer.
Anybody with heart failure, I would recommend it as an alternative, especially if your exercise capacity has been limited. Really is one of the best options available.
I have my life back.
There's a heart treatment that just might give you your life back. Up until now, patients with serious heart disease such as angina received invasive procedures such as angioplasty and open heart surgery as a standard treatment. Now there's an effective procedure that's non-invasive, non-pharmacological, and non-surgical. It's a therapy called Nicore ECP. ECP stands for external counterpulsation and has been helping patients for over 10 years. ECP is an FDA-approved treatment for patients with the debilitating pain of angina or fatigue associated with heart failure.
It's not a surgical option. Most of the patients are like, there's nothing else the doctor said they can do for me, so here I am, and I'm willing to try anything in it. And when they feel better, it makes you feel better.
The Nicore ECP system delivers amazing results without the risk of surgery or drugs. ECP is especially indicated for patients who have undergone surgery or angioplasty and take medications but are still experiencing symptoms. Here's how ECP works. Heart patients simply lie down during therapy. During the 1-hour treatments, patients usually spend their time reading, watching TV, listening to music, or even sleeping.
It's phenomenal. It really is. The patients they're just so much better. There have been times where it seems like it hasn't helped them all the way through the 35th treatment, but then when we see them a month, 2 months later, they are telling us that they're actually walking to the post office and that they're walking the malls and they're being able to play with their grandchildren.
I can go up and down the steps. I can go out and walk around in my yard. I can take care of my house.
That's what's so rewarding, is being able to see them do much better.
ECP uses compression to reduce the workload of the heart and to stimulate the circulatory system. Inflatable cuffs, a lot like blood pressure cuffs, wrap the calves, thighs, and buttocks. Compressed air in the cuffs forces blood up from the lower body upward to assist the heart. The patient is carefully monitored during treatment.
When the patient comes in, we do a complete cardiovascular assessment, which includes blood pressure, listening to the lungs. We do lab work on the initial visit. We do what we call a bio-Z, and that just is a diagnostic test that checks the pulmonary pressures and the heart. We will put them on the table. We hook them up to a telemetry unit so we can monitor their heart.
Patients may begin to feel relief after only 8 to 10 treatments.
Gradually, one day I realized I could do more and more and more. And it's been just great. It's been 2 months now, and I think that I still continue to get better.
Clinical research has proven that ECP can restore energy levels and greatly reduce angina pain in over 80% of patients. Researchers have found that ECP pushes oxygen-rich blood to the heart and throughout the body, causing the release of natural growth factors. These natural growth factors play a role in developing new arteries and supporting cardiovascular health.
I feel great today, and most days. 3 months ago, I could not have walked down this hallway. I would have had to have come part way and stopped and got my breath back. I couldn't have talked to you while I was walking because I just did not have the breath to do it. And I do find that I continue to get better.
A course of ECP therapy consists of 35 1-hour sessions delivered 5 times a week for 7 weeks. Insurance and Medicare normally cover most of the cost. The benefits of Nicore ECP include better heart function, more energy, improved exercise ability, reduced medication, enhanced quality of life. Ask your doctor about ECP therapy. It could give you your life back.
I wouldn't refer this to people if I didn't see some clinical benefit, and virtually everyone I've sent here has benefited. I think it's a reasonable alternative to consider for just about anybody. Most of the people I tend to see in my practice have congestive heart failure and or angina that's been revascularized either surgically or with percutaneous intervention.
The Nicore ECP system doesn't have the risk or side effects associated with surgery, drugs, or other invasive procedures, and there's no recovery time.
It's a miracle worker. It gives them their life back.
Discover what thousands of others have discovered, that life can be good again. ECP therapy is offered in over 800 top hospitals and cardiology practices across the U.S. These include Wake Forest, Johns Hopkins, the Mayo Clinic, Akron General Hospital, and the Cleveland Clinic. Ask your doctor if ECP therapy is the right treatment for you. ECP therapy reduces the debilitating pain of angina and fatigue associated with heart failure. Get your life back. Nicore ECP.